third type of stroke you can have is like our variant angina. It's a variant type of stroke, meaning that a blood vessel going to the brain can have a spasm, blocking the blood to that particular part of the brain, and if it relaxes soon enough, there won't be any particular damage. So now, a variant type of stroke would be where the blood vessel goes into spasm, like a variant angina. Now I know that you all think how brilliant Dr. T is. So now I'm going to tell you how stupid I am. Okay? Pardon me if I get emotional. 2 years ago, March 1st, 2005, I had that type of a stroke. That's why you see me limping. A blood vessel burst in my brain because I had high blood pressure, and I refused to do anything about it. I'm bigger than that. I don't need medicine. I'm strong enough that could never happen to me. What a fool. What a fool I was. And then one day sitting at my computer, I reach for a tissue, and I try to bring it to my face, and my hand is still there. And I realized I couldn't move it. Then I realized I could not get up. And I realized I was having a stroke. On my back, I'm getting down to I couldn't walk on my back. I slid over to a telephone and called 911. And as I was telling one of these young ladies here, I was taken by the emergency to the emergency ER, emergency room. And at that point I was unconscious. If the ER doctor would have misdiagnosed me and assumed that I had a clot, and that was causing it. The treatment for a clot type of stroke is a clot buster, what do you call it? TPA. Would be what they call commonly a clot busting chemical. They inject it and it breaks the clot down. But by the time I got to the hospital, chances are that I had already been forming a clot where this broke to stop the bleeding, just like it would stop any place else. And if I would have gotten a clot buster, it would have broken that loose again, and I would have surely died. So my thanks to the ER doctor that saved my life. So you see, we can be smart, but we can be very stupid. And for that, I lay in the hospital bed for almost a month, unable to walk, unable to turn over. And again, once I was sufficiently healed, they felt, they immediately got me up on my feet, this wonderful hospital in Walla Walla. They got me walking, and it was a terrible, traumatic thing to try to walk when your limbs don't want to work. I mean, my left side was fully paralyzed. I couldn't even move my foot like that, dorsiflex or plantar flex. Couldn't even turn over in bed. So I praise all the nurses. Do we have any nurses in here? God bless you. You're wonderful people. Okay. Said my story, made my confession. You have in your books, in this book, page 94, a list of the factors that will increase your risk of cardiovascular disease. I'll read them for you quickly. High-fat diet, rancid fats, trans fatty acids, constipation, ionizing radiation, fluorinated water, and homocysteine, which I covered. The factors that reduce your risk of cardiovascular disease: B complex, especially B6, niacin, riboflavin, vitamins A, C, and E, minerals including zinc, manganese, selenium, molybdenum, copper, magnesium, and chromium. Anyway, there's a full list of it right there. And of course, all the references are there on page 95 and 96. I've got 29 references there on that particular chapter. We did it, guys. We did it. Yes.
need to know the answer to what nutritional supplements can prevent clots and
Vitamin D,
vitamin E.
omega-3, and selenium. I will accept those three, but the B6, of course, is included in there. That's for your own edification. The more of these things that you include in your diet, the better off you're going to be.
Question?
Take more questions. Time.
Oh. Oh, sorry. Did you want the questions or no? Yeah. Okay.
Yeah.
So great, and she's hearing about it now as being this new superfood.
Where's my nutritionist? Have you heard of anything like that?
Well, yeah, and coconut oil, palm oil, and those can be pro-atherogenic.
Pro-atherogenic, that means causing...
Coconut oil, palm oil, and what other type of oil?
Well, tropical oil.
Tropical oils.
So, I don't know the background for this new science about coconut oil.
No, nor do I.
But I just know that it's a medium chain triglyceride, and those tend to be pro-atherogenic, whereas the long-chain triglycerides, like uric acid, like the omega-3s and omega-6s, are not.
Basically, the tropical oils, coconut, will tend to cause atherosclerosis. They're a medium chain acid, but the longer chain acids are the ones that tend to be good for you, like the omega-3s.
Oh, you were here. She was on her. Go ahead.
She says she understands that heart disease can be genetic. Can some of the dietary things prevent the genetics?
That's a very interesting question, but it's a very difficult question to answer. When we talk about genetic, we could be talking about a particular factor, genetic factor, that is such that your intestinal tract does not absorb one of these nutrients as efficiently as it should. It has so many possibilities. So how